We are back here on Healthy Living, and we're talking infectious disease. And again, I think it's a conversation that doesn't come up a lot, or at least with someone who has some, who is able to really discuss it. Is the point of treating an infectious disease to eradicate the cause, to manage the damage done? What is your mindset for what you're doing?
Sure. I mean, it really depends on the organism that we're treating. Sometimes if we're dealing with viruses, there's some viruses that we cannot eradicate completely, such as HIV and herpes virus.
Okay.
So we can treat those, but we can't rid a person of them completely.
So let's stop with that one, because that's a good one, because those are things that people have heard about all the time. Let's talk about herpes viruses, and they come in a lot of different ways and shapes, forms, and things like that. If someone would have the herpes virus, is that a time to really come to you for a specific treatment protocol?
So if someone has frequent outbreaks, they can be prescribed suppressive therapy. So I can see them to sort of discuss the need for suppressive therapy for that.
Is part of your job to educate the patient on how to manage this as much as cure, I guess? Is that
I think a big part of my job is to alleviate some of the fear and around infections. I think many patients are just, they hear lots of scary words and they become very concerned, just to demystify the whole thing.
Exactly.
Explain the nature of the bacteria, explain, where it lives, how they got there. Oftentimes people feel like they've done something wrong if they got an infection. And it's mostly just explaining that, no, these are things that just surround us
all the time.
All the time.
Well, it's so interesting to me because I'm a little dramatic. and I think many of us have that kind of fear factor in us. And I know even with COVID, I think the questions at least come to mind for me all the time is, we're traveling. Do I go ahead and wear a mask? Are there things I can do to just be a good steward of my own body that aren't that tough to do, but that can really prevent me from getting sick?
Sure. Yeah. I think that there's many. A big thing is to stay on top of vaccinations. For their annual vaccines for things like COVID and influenza, but also there's age-appropriate vaccines where there's recommendations for.
You said that purposely for me. I know. I did my shingles.
Very
I've gotten
good.
every single COVID vaccination known to man twice.
I'm very proud of you.
Thank you. I am too.
There's a pneumonia vaccine booster for folks over 60, and there's an RSV vaccine now available, and just keeping on top of that.
Well, let's talk for a second about vaccinations, because what I thought could never be controversial has become a bit controversial.
Yes.
But I grew up in the era of they gave you a sugar cube with a polio vaccine on it. You just ate the sugar cube and that was the end of that.
Yes.
There was no discussion. So you really believe that vaccinations can be important. What is it that a vaccination really does? What's the point of a vaccination?
So the point of the vaccination is to reduce your chance of contracting a disease, and in the case, if you do contract it, to reduce the severity with which you will experience it. So, for example, in a recent measles outbreak.
I was just going to say, what about measles?
Right. So, out of I think we're now above 2,000 cases nationally, and out of those, 98% of folks who got sick were unvaccinated.
Oh my gosh.
So you can, that just shows you how important it is to be vaccinated, because, and the same percentage holds for people who become hospitalized, for people who develop severe adverse reactions.
Let me ask you a question about, have we become a bit complacent about vaccinating? Like the plague, that was so, forever ago. Or like you said, measles.
Yeah.
I remember measles, mumps. There were all kinds of things we got vaccinated for as kids, and I think now you still do.
I think we have, and I think it's human nature to become somewhat complacent. When you don't see the worst side of something, you become to forget how bad it was.
1917 flu epidemic,
Right.
that kind of thing?
That kind of thing. When I think we've sort of, we don't remember how many tens of thousands of people became ill with it and how many thousands died. And that's just something to consider, you know, when thinking of vaccines. And because we've lived in an environment of herd immunity for so long, where
Correct.
vaccination rates were 95%.
Explain really quickly what herd immunity is
Sure.
for the viewers.
So when a sufficient percentage of the population becomes vaccinated,
Okay.
a virus or any kind of disease that the vaccine is intended to prevent doesn't have an avenue to spread easily.
Got it.
Because so many people are vaccinated, it just doesn't know how to
It
spread.
dies out because there's nowhere to go.
Right.
Okay.
And as that drops to 90%, 85%, 80%, 75%, the virus finds an avenue. Well, great. There's some unvaccinated people.
Yeah, we'll go to you. Okay.
Yeah.
It's really fascinating, quite interesting, and I think it's talk about a public health discussion. It really is. I think it's a treat to actually visit with you and begin to open the discussion around these kinds of issues. I think you offer a perspective that is really important to a lot of us. So thank you for taking time today.
Thank you.
Thank you for joining us here on Healthy Living.
Thank you for speaking with me.